A very warm welcome to this UCL lunch hour lecture entitled From Threat to Opportunity, Putting Health at the Center of Our Response to Climate Change. My name is Professor Audrey Prost, and I'm the head of the Department for Global Health Equity and Social Justice at UCL's Institute for Global Health. It's a great privilege and pleasure to introduce today's speaker, Dr. Marina Romanello. Dr. Romanello is the executive director of the Lancet Countdown, tracking progress on health and climate change, which is an independent, multidisciplinary research collaboration with over 100 academic centers around the world and is headquartered at University College London's Institute for Global Health. Marina originally trained as a biochemist in Buenos Aires in Argentina and also holds a PhD in biomedical sciences from the University of Cambridge. She's a globally recognized leader in climate change and health research, and in recognition of her achievements, she's recently been appointed to the Adaptation Committee of the UK Climate Change Committee. The 2024 Lancet Countdown report came out earlier this month, prior to the ongoing COP29, and it paints a dire picture of progress towards mitigation and adaptation goals, but it also highlights the value of putting health at the center of the climate response, which is what Marina is going to tell us about today. She's actually at the COP today, so we're doubly lucky to have her. Before we begin, I just want to remind you that we'll have some time at the end of the lecture for questions, and that you can submit these at any point by going to Slido. We'll put the link into the chat, or going to Slido and entering the event code #ClimateChange. And I'm now going to hand over to Dr. Marina Romanello for her talk. Thank you, Marina.
Thank you, Audrey, so much. Thank you, everyone, for joining. I'm so delighted to be here with you. I'm actually now at COP in Azerbaijan, so it's a very timely conversation that we're having, and I'm so delighted to see so many people interested in knowing more about climate change and health and our work led here by the Institute for Global Health at UCL. So I'm going to talk to you a bit about our latest findings of the Lancet Countdown report that we launched very recently, just a few weeks ago, ahead of the COP negotiations. The latest report that we've launched is the latest in a series that has started straight after the Paris Agreement got signed in the year 2016. The Lancet Countdown was put together following the second Lancet Commission on Health and Climate Change, which concluded that climate change is the biggest global health threat of the 21st century, but that tackling climate change through a health lens could bring the biggest global health opportunities of the century. That commission, published in 2016, also recommended that we needed to monitor progress against the delivery of the Paris Agreement, because with these new commitments to tackling climate change, there were so many opportunities at hand to deliver huge benefits for health, to transform global health. And we needed evidence to inform how our actions or inactions on tackling climate change were improving people's health and well-being or harming it. And we also needed to have evidence to inform decision makers in tailoring the responses to maximize the huge potential for health co-benefits that could come associated with acting on climate change, reducing emissions, adapting and responding to the threats that we're facing. So it's like that the Lancet Countdown got put together. The Lancet Countdown is an independent international collaboration. It brings together 57 contributing organizations and authors around the world. Globally, we have these 57 authors and the institutions you see on screen, but we now also have 6 regional centers that are helping bring our findings to a regional and a local level. And what we do is every year ahead of the COP climate negotiations, the meetings of the UN to address the global response to climate change, we put together a report with over 50 indicators that monitor the different aspects of the relationships between health and climate change. Our indicators monitor the growing health impacts of climate change on health, monitor the evolving hazards. We also monitor the extent to which our response to climate change is protecting people from those growing risks, the extent to which our health systems are preparing to function in a world of more and more unstable climate, and the extent to which we're giving the vulnerable populations the protection that they need not to suffer those huge impacts. And that is what we call adaptation to climate change. We also monitor the reduction of greenhouse gas emissions, what we call mitigation. And with that, the potential health impacts of that reduction, the extent to which our actions to reduce emissions are benefiting people's health. But we go way beyond that, and we take a holistic approach where we also monitor the economic implications of the health impacts of climate change, how much climate change impacts on health is costing our economy, and the extent to which our economic transition is enabling a healthy future, the extent to which we're adapting and responding through economic transitions towards healthier economies globally. And finally, we also monitor the extent to which key actors in society are understanding that when we talk about climate change, we're talking fundamentally about the biggest threat to people's health and about tackling climate change being the biggest health opportunity of the century. So the extent to which we're putting health at the center of that conversation. And as you can see on screen, we bring colleagues from all around the world to monitor these different aspects of the intersection between climate change and health through an interdisciplinary lens. We cut across disciplines to bring everyone, all hands on deck, to solve this huge challenge that we're facing. We work in very close collaboration with the World Health Organization, and we lead this collaboration from UCL, from the Institute for Global Health. Our latest report got published just ahead of this COP where we're at now, when the conversation about how to address climate change is ongoing. And the biggest finding of our latest report is that across all of the indicators that we're monitoring, climate change risks to health are getting worse. And in fact, out of the 15 indicators on which we monitor the climate change related hazards, exposures to those hazards, and the impacts of climate change, 10, 2/3 of them, reached a concerning new record high in the latest year of data, generally 2023. You can see that on screen through this heat map that I'm showing you, where we have represented the data from each of our indicators, colored from blue, that is the best situation for health from our data set, to red, the worst, the most concerning implications for health. And you can see this clear trend of things getting towards those very dark red, the asterisks showing where those records are in the latest year of data, and painting a very clear picture that across the multiple dimensions of health, climate change is increasingly threatening our health and well-being. So let me give you some examples of what these numbers, what these colors mean. The first thing that I'm going to talk to you about is heat-related mortality. When we talk about climate change, heat-related mortality is one of the most prominent aspects of climate change, because obviously temperatures are rising globally and people are increasingly being exposed to very high, very extreme temperatures. Exposure to extreme heat is not just very uncomfortable, it's also potentially lethal, particularly to very vulnerable communities. Elderly adults over 65 years of age are at a huge risk. Also very young children, particularly babies under 1 year of age. Also people with underlying health conditions, with heart disease, lung disease. Climate change can exacerbate those chronic conditions and tip them over the edge, representing a very strong health risk to those suffering from chronic conditions. There's also evidence that exposure to extreme heat affects pregnant women, affects their babies. So it's also a risk for the for pregnant women and for birth outcomes. And it can also lead to adverse health outcomes in terms of mental health. We have evidence that exposure to extreme heat exacerbates mental ill health. I was just here talking with the Australian delegation on climate change and the Australian Ministry of Health, and they were telling me they have a new study that shows that every 1 degree of temperature increase, the admissions of adolescents to emergency mental health units and the cases of suicide and suicide attempts increased by 1.2%. This is really, really strong increases. And what you can see on screen is how we measure just the tip of this iceberg, that is measuring heat-related deaths of adults over 65 years of age. And as you can see on screen, since the 90s, heat-related deaths of elderly populations have increased by 167%. And this is way more than the increase that we would have expected if temperatures hadn't changed, if driven only by changes in population size. So we know that it's climate change driving the vast majority of this growth in heat-related mortality. And as I said, heat-related mortality, just the tip of the iceberg, is associated with huge morbidity, huge increase in the diseases associated with heat exposure that sometimes are a lot more difficult to measure. Apart from the direct health impacts, climate change is also affecting through heat exposure our health indirectly. And one of the interesting relationships between climate change and reduced and ill health or reduced health outcomes is related to exposure to extreme heat and its implications for physical activity. So what we find is that because temperatures are growing so rapidly and exposure is increasing, people are increasingly being exposed to health threats of moderate or worse heat stress when undertaking light outdoor physical activity, even worse when undertaking extreme physical activity. So in 2023, a year when we saw record high temperatures globally, we estimate that each person was exposed on average to a record 1,512 hours each year, during which, if undertaking physical activity, they would have been exposed to at least a moderate risk of heat stress and the associated adverse health outcomes, almost a 30% increase about 1990 levels. So this means two things. One, that people, when undertaking physical activity so essential for good health, are being put at risk. Their health is being put at risk because of the high temperatures. And it also means that the number of hours available for safe outdoor physical activity is decreasing. So people protecting themselves will undertake less and less physical activity, obviously a problem for health. Apart from those undertaking physical activity, we also see impacts on workers. Those impacts on workers will be direct impacts, direct risk of heat-related diseases, heat stress and heat stroke, that is a medical emergency, but also a reduction on their labor capacity. To any of you that has tried to undertake physical activities or physical labor under extreme heat conditions, you will have found that it gets exhausting very quickly, that you need to take more breaks to hydrate, that at times you just cannot work outside because the temperatures are too high. And that means that we're losing hours of labor and of potential labor. And again, in 2023, a year of record high temperatures, heat exposure resulting in an estimated 512 billion potential hours of labor lost globally. This is almost a 50% above the losses in the 1990s. And this means that people are increasingly being limited in their labor capacity, being put at risk when working outdoors. And as you can see in the graph that I'm showing you there on the left, the vast majority of these losses occurred in the agricultural sector, with agricultural workers generally having very little capacity to protect themselves from heat exposure. They have no choice but to work outdoors. In general, there's little availability of systems for cooling when they're working the land. And in general, it's workers on whom local food security depends. So if labor productivity falls in this sector, it could also affect the availability of food locally, with implications for food security. And the other aspect that is obviously very important is that this loss of labor productivity translates to losses in income. We estimate that in 2023, these lost hours of labor translated to a record high of a potential of $835 billion in income that were lost. This is a huge amount. To give you some perspective, the commitments that developed countries or so-called developed countries under the UNFCCC had given the so-called developing countries for health finance were only in the order of 100 billion. So this is a huge increase as compared also to support for action on climate change. And the interesting thing is that when we look at countries according to their Human Development Index, which takes into account their educational performance, their health access, their GDP, and their economic status, we see that it's the countries that have lower levels of Human Development Index, generally the poorest countries, that bear the biggest brunt to their economies, losing an average of 7.6% of their total GDP as a result of the labor capacity loss due to heat exposure. So this is having a huge toll on economies. And as you can see there, particularly big toll on agricultural workers. Now, the other dimension of this is not only important for the economy, but it's important for people's livelihoods, for people's well-being. It's affecting people's incomes. And that affects, obviously, the economic conditions on which good health depends, their access to good health, their access to food. And as a result of these compounding impacts, we're seeing that the increased number of heat waves and droughts events since an average of 1981 to 2010 has resulted in 2022 to 151 million more people experiencing moderate or severe food insecurity. This means that the increased impact of heat waves, the increased impact of droughts are now having a direct impact on food insecurity, with people self-reporting they cannot have access to the food they need for their healthy lives. And obviously this will have a huge implication on nutrition. We will see an increase in the malnutrition associated to the incapacity to access good quality food. One other factor that has become really noticeable, and this is something new in our latest report, has to do with extreme precipitation events. These are days in which we see a very extreme rainfall, a very big volume of rainfall falling in just a very short period of time. And what we've seen in our last report is that during the last decade, 61% of all of the global land area saw an increase in the average annual days of extreme precipitation days compared with previous decades. And you probably will have heard of what happened in Spain in the past weeks with that extreme rainfall event causing devastation in Valencia. Something similar had happened in Brazil when, again, a very extreme rainfall event collapsed a dam in the south of Brazil and generated devastation. We've also seen it throughout Asia, throughout Africa. These extreme rainfall events increase the risk of floods, put very big challenges to our infrastructure, and obviously that leads to direct mortality due to drowning, due to exposure to flood-related hazards, but also due to the disruption of sanitation and to people getting in contact with contaminated water, increasing the burden of communicable diseases enormously, and also exposing people to toxic chemicals that come with the lixiviation, with the water that drains and floods our cities and our homes. And apart from these increase in extreme precipitation events and the increased flood risk that entails, we're at the same time seeing an increase in drought events. These can often coexist with very long periods of drought that are cut by days of very extreme precipitation. And this is because the patterns of the climate of rainfall are changing and are becoming extreme in both directions. So aside from this increase in extreme precipitation events, we're also seeing that in 2023, 48% of all of the global land area was affected by at least 1 month of extreme drought. And this is a huge increase from just 15% in the 1950s. If you look at the map that I'm showing you, you will see that very vulnerable parts of the world are being very affected by over 10, often 12 extra months of extreme droughts than in the 1950s, including areas of the Horn of Africa, where the drought situation in the Horn of Africa has been directly attributed to climate change. We've seen that climate change had caused an increase or an increased intensity of that drought, and where we have also evidence that that drought has contributed to the acute hunger situation in the Horn of Africa. Obviously, droughts will damage our crops, damage our food productivity, reduce access to safe water, disrupt sanitation, and increase the risk of transmission of infectious diseases. The health impacts of droughts can be very pervasive, can be very extensive. And finally, with these changes in precipitation patterns, in temperature, we're also seeing that the pattern of transmission of some deadly infectious diseases that often are public health concern is also changing. I'm showing you here just 2 examples, but there's many, many more. This includes infectious and diseases transmitted by vectors, by arthropods in general, diseases that are transmitted by water, by air. And we're seeing that the changing climate is changing the geographical distribution and the likelihood of transmission of these deadly diseases. For example, we look at dengue, where we see that the transmission of dengue by the mosquito Aedes albopictus has become more and more likely, increasing by 46.3% since the 1950s. And Aedes albopictus is the main vector that we see in Europe, in some parts of Asia. So this increase is concerning and points towards dengue probably being distributed now to places where we didn't see dengue transmission before. Likewise, we're seeing the waterborne pathogens, Vibrio bacteria, that are being increasingly transmitted by exposure to coastal waters becoming more and more suitable. And in 2023, we've seen an estimated record high of 692,000 cases of transmission of Vibrio pathogens due to the very suitable conditions in coastal waters that have become quite warm over that year. And this is obviously very concerning. These are flesh-eating bacteria. These are bacteria that generate acute infections in the skin that can increase the risk of sepsis. They generate gastrointestinal infections as well. But what is interesting is that all of these impacts are happening not in isolation, but often all at the same time. We're seeing this increase in heat wave exposure, the increase in the likelihood of transmission of deadly infectious diseases, extreme weather events, affecting the same parts of the world, affecting people and compounding each other, adding extra pressure to our health system, deteriorating our health and our health outcomes. The concerning finding is that while we see this very pervasive health impacts and health risks growing and growing and growing year on year, governments, companies continue exacerbating the risk, continue fueling the fire, putting the health and survival of people around the world at risk more and more. Why do we say this? Just looking at one of the key aspects that have to do with our capacity to absorb greenhouse gases from the atmosphere and stop temperatures from that sharp increase, what we call climate change mitigation, has to do with our tree cover. We know that tree cover is the natural way that we have to absorb carbon dioxide and the main greenhouse gas from the atmosphere and limit temperature increase. So forest cover, tree cover is hugely important to prevent climate change from increasing further and further and to prevent the health impacts from rising more and more. And what we see is that although we have this hugely valuable resource to reduce climate change and to reduce the concentration of greenhouse gases in our atmospheres, we have lost in 2001, 459 million hectares of tree cover. The 11.5% of all of the global tree cover was lost since 2001. And when we look at why we're losing more and more tree cover, we see that there's 2 activities that are the main 2 contributors. One is forestry, our forestry activities, and the other one is our shifting agriculture. We're cutting down trees, we're losing biodiversity that is also essential for health, but we're doing so also through activities that are harmful to health on their own right. And agricultural activity and carbon-intensive agricultural productivity has strong implications for climate change, not only because it takes a lot of land, but also because it contributes directly to greenhouse gas emissions. What you can see on the left is the estimated emissions from agricultural production globally. And we see that it has increased by 2.9% from 2016, the year the Paris Agreement came into force, to 2021. And that this increase has been driven mostly by an increased production and consumption of red meat and red dairy. the production of which takes up a lot of land, contributes to that deforestation, and contributes enormously to greenhouse gas emissions. But interestingly, the overconsumption of red meat and dairy also contributes to a big burden of disease. We estimate that deaths from excess red meat intake, as you can see on the right, have increased from 14 to 16 per 100,000, a 9% increase since 2016, associated with this increase in red meat production and consumption. Overall, transitioning to low carbon, healthy diets could help reduce about 11.2 million deaths every year. So there's an enormous opportunity here to tackle greenhouse gas emissions by transitioning to healthier diets, reducing the direct emissions from our cultural sector, and also contributing to stopping that deforestation that agriculture is contributing to, or at least reducing it. Looking at the second aspect is not only that we're reducing our capacity to absorb greenhouse gases from the atmosphere, but we're also increasingly pumping greenhouse gases up into the atmosphere, contributing to a very sharp increase in concentrations of carbon dioxide, which we have seen over the past years. The main sector that contributes to greenhouse gas emissions is the energy sector. The energy system is contributing to kind of over 2/3 of all greenhouse gas emissions, and global greenhouse gas emissions from the energy sector have been increasing year on year, reaching an all-time high in 2023, 1.1% increase above 2022 levels, as data from the IEA shows, the International Energy Agency. So we're reaching record high levels of emissions, and we're not really reducing the carbon intensity of our energy sector. That is the amount of carbon dioxide that we produce per unit of energy generated. We have the tools to do so, but action has not been nearly fast enough. So why do we talk about energy system emissions when we talk about climate change and health? Obviously, it exacerbates climate change, it increases the risk that people face, but also it has direct implications to health. When we look at energy access is hugely important for good health and well-being. Transitioning to healthy renewable energies could provide energy access to off-grid areas, to areas where we don't have access to the energy lines. And we're seeing that today, about 2.4 billion people still rely on dirty fuels and inefficient energy technologies in their homes. About 30% of households globally still rely on biomass burning to meet their energy needs. And if we look again at countries according to their Human Development Index, we see that low Human Development Index countries are provided to about 92% of all of their energy by biomass. Biomass being, for example, the burning of wood, the burning of dung, a very inefficient source of energy, and a source of energy that also puts people at risk, particularly women and young children, when they go and look for that fuel for their homes. So this is basically energy poverty, lack of access to electricity, lack of access to reliable energy sources. And that has huge implications because it impacts on people's capacity to access cooling services that are needed to keep our medicines, to keep our food, to our sanitation. It impacts on our capacity to access education services, information services, and it keeps those women, those children that are tasked with finding the fuel away from education, for work, and from labor opportunities. And all of that has huge implications to development and obviously to their health outcomes. And as a result of this burning of biomass and dirty fuels inside people's homes, people are being exposed to very high levels of air pollution that comes from this combustion. We estimate that indoor small particulate matter, or PM2.5 air pollution that comes from the burning of solid household fuels has resulted in about 2.3 million deaths in 65 countries in 2020. And as you can see in the graph, we see big inequalities in terms of rural populations being worst affected, those populations that generally have less access to safe energy. So this is what energy poverty looks like: people not having access factory-level energy, being exposed to toxic air inside their home. And these are all avoidable situations through access to clean, renewable energy. It's a consequence of our persistent reliance on dirty fuels, on fossil fuels, and not having provided equitable access to clean, renewable energies. The other aspect that we're seeing here is that not only have we not encouraged the adoption of clean renewable energy enough, but we have also persistently supported fossil fuels. We're still very reliant on fossil fuels in our energy grids, and we have perpetuated that reliance on fossil fuels through subsidies. Countries still largely depend on fossil fuels to meet their energy needs. And what that means is that when energy prices spiked after the war in Ukraine and the energy crisis that we've seen, many countries saw themselves in the need to increase their fossil fuel subsidies to keep energy affordable to local populations and avoid a sharp increase in energy poverty that, as we said, is a health issue. So as a result, what happened is that 84% of the 86 countries that we've analyzed were subsidizing fossil fuels in 2022 for a net total of $1.4 trillion, record high levels of public finance being allocated to subsidizing the fossil fuels that are harming our health. And this completely dwarfs any sort of financial commitments for climate action. Now at COP, we're discussing the financial support that we will be providing, particularly the most vulnerable countries, in terms of a just transition, in terms of access to clean energy, and is nowhere near the order of trillions, although we would need much more than that. So what we see is that there's a lot of public funding being allocated to perpetuating the consumption of fossil fuels. Countries keep on being dependent from fossil fuels, and it has led to this wasteful spend of 1.4 trillion that could be avoided by transitioning to clean renewable energies, and funds that could be redirected to supporting improved health, improved well-being, to strengthening our health services, to strengthening our energy grid, and providing clean access to energy. What is interesting is that these subsidies exceeded in 30% of the countries that we've analyzed, exceeded the equivalent of countries' total health budgets, which means that 30% of the countries that we've looked at allocated more to subsidizing fossil fuels than to their total health budgets. So that is how wrong our priorities are. We're harming people's health actively. And the other side of this coin is that because of the high energy prices, fossil fuels have become a very, very profitable business, more than they used to be. So as a result, the world's 114 largest oil and gas companies have increased their planned fossil fuel production levels even since last year. This is completely against any sort of commitments being made in the UN climate negotiations, in the Paris Agreement, and an active threat to people's health and survival. These 114 companies are today on track to exceeding their levels of emissions compatible with the goals of the Paris Agreement of limiting global mean temperature rise to 1.5 degrees by 189% by the year 2040, an increase from 173% just last year. So we're increasingly planning to produce more and more fossil fuels, putting people's health more and more at risk. And the other consequence that this has is that we keep on expanding a sector of the economy that we know has no place in a healthy future. We keep on allocating resources to expand the production of fossil fuels that we know we cannot burn if we want to keep conditions under livable circumstances in line with the Paris Agreement. What we're seeing here is that the current assets of coal-fired power generation are increasing in their value that will not be able to reach economic productivity if we want to keep temperature increase within healthier conditions. The value of current assets projected to become stranded to not reach productivity between 2025 and 2034, which will reach a total of $164 billion US dollars globally. This means that we keep on allocating enormous amounts of finance towards wasteful spend. And we're increasing the risk to our economies as a result. And what's worse is that we're seeing that the investments in fossil fuels keep growing. They attracted 37% of all global energy investment in 2023. And we're seeing an increase in investments in fossil fuels since 2020. This is increasing the value of those stranded assets, putting economies, entire countries' economies at risk as a result. And what this means is that many countries are very unprepared for that transition. That preparedness for a healthy transition will be determined by institutions, by economic performance, by reliance and investments on fossil fuels. And as you can see there on screen, it is the countries with lower levels of Human Development Index that are most unprepared for the healthy transition, for the transition to meeting the Paris Agreement commitments, and therefore whose populations are more at risk because that transition will need to happen, but currently is very unjust. We haven't managed to deliver a just transition. And another important finding is that to tackle climate change through a health lens, through a healthy transition, we really, really need governmental support, we need political will. And what we're seeing is that that political will is decreasing, has been decreasing over the past 2 years, and that the proportion of leaders making references to those crucial links between health and climate change in the UN General Assembly, a key forum where they put forward their priority, has declined from 50% in 2022 to 35% in 2023. And as we see more and more world leaders denying climate change, fighting the science, these findings are very concerning, and we crucially need to reverse it to keep up the momentum on climate action and to protect people's health and well-being. However, I've given you a lot of very bad news, but we do see some signs of hope, some signs of progress, which we have to build on, which we have to strengthen in order to protect people's health and well-being. For one, despite the big emissions associated to the energy sector, what we are seeing is that the adoption of clean energy is increasing very rapidly. It still hasn't managed to completely to replace fossil fuels or to decrease the carbon intensity of our energy system substantially, but it is increasing. And this means that more and more we're starting to use clean energy, non-polluting energy. We're also seeing that employment in the low carbon energy industry is increasing. It now exceeds the direct employment in fossil fuels. And this means that we're giving people healthier and more sustainable jobs, essential for good health, good well-being, and protection of livelihoods. One of the indicators that we're most excited about has to do with the reduction of air pollution that comes from the reduced pollution from fossil fuels. We've seen that from 2016 to 2021, we've decreased the deaths associated from air pollution coming from the burning of fossil fuels by almost 7%. And that the vast majority, 59% of this decline, was due to collective efforts to reduce coal-related pollution. And what this is showing us is that there's a huge potential to prevent death today immediately by phasing out fossil fuels, by reducing fossil fuel-based pollution. And we estimate that we could save even more than the 2.09 million deaths that I'm showing you on screen. We could save about 4 million deaths very rapidly by transitioning away from fossil fuels and adopting clean renewable energies, by reducing exposure to air pollution outdoors and indoors. And finally, we're seeing that as a result, mostly of efforts from the health sector, from the WHO, more and more countries are starting to engage their health systems with climate change. We're seeing that more and more countries are signing up to the WHO's Alliance for Transformative Action on Climate and Health, where it's providing a forum for engagement, for learning from each other, and from increasing ambition on tackling climate change and promoting these huge health benefits that it could deliver. We're seeing that more and more countries are also starting to prepare to respond and protect their populations from the risks of climate change. We're seeing that the number of countries undertaking vulnerability and adaptation assessments has grown from 11 in 2022 to 50 the year after. And that countries that are planning their adaptation for health and how they're going to deliver an adaptation program to climate change for improved health and well-being has increased from 4 to 43% from 2022 to 2023. So more and more countries are taking the lead in protecting our populations from the growing hazards. The scientific community is also engaging more and more on climate change and health. The number of scientific papers researching these links between health and climate change is increasing really rapidly, as you can see on screen. It's reached high record levels in 2023. We're still focusing mostly on the impacts of climate change on health, not so much exploring the solutions, but this increased engagement is really important. One thing, though, that I wanted to note is that most of this research comes from high-income countries, China and India, with much less research coming from some of the most affected parts of the world, like South America, Africa, and South Asia, or Southeast Asia, rather. So there's a lot that we need to be doing in terms of enhancing more the engagement of scientists around the world in tackling these crucial issues. And another area that gives us a lot of hope is that educational institutions, particularly institutions providing public health education, are increasingly providing education on climate change, which is so essential to empower health professionals in giving a robust response to climate change, in ensuring that health is protected in the face of climate hazards, and that the health benefits and co-benefits of climate action can be maximized, including by transitioning to healthier diets, reducing air pollution, increasing access to safe energy. And we have a lot of opportunities at hand. We've identified new opportunities that could be delivered this COP and throughout the next year in terms of improving our action on health and climate change, to which it's very important to have the health community engaging. We have countries that are due to updating their nationally determined contributions, their plans on how they will act and tackle climate change that is due in 2025. Prioritizing health in these commitments is hugely important. Redirecting fossil fuel funds, that 1.2 trillion allocated to subsidies and the persistent financing of fossil fuels towards activities that promote and improve people's health, could help unlock the climate finance that is so desperately needed. We're negotiating here at COP a new collective quantified goal on climate finance and the loss and damage funds, two funds that are critically important to supporting the most vulnerable countries in the transition. And we're in a very acute need for ambition in those targets. The finance is available, it has to be redirected, and we can support that through a health lens. We need to set health and well-being as the key metric of climate action. We need to ensure that health improvements are at the center of our goals to address climate change, to ensure that our actions do derive in improved health and improved well-being. We need to make health and equity central to our Just Transition Work Program, to our negotiations here. And we have to ensure that our health systems are low carbon, are climate resilient, can protect populations and do no harm in doing so. And obviously, as a health community, we can also do a lot in terms of addressing the root causes of ill health. We can help encourage healthier diets. As I said, carbon-intensive diets are big drivers of greenhouse gas emissions and deforestation. We could promote healthier diets that don't harm our environment. We can promote the adoption of clean energy and standards, of healthy air quality standards, and therefore support that healthy transition. We can encourage safe, active travel measures to reduce air pollution in cities and increase physical activity levels. In all of that, we're critically important. So there's a lot to be done and a lot of concerning findings, but we also have a lot of opportunity for hope. So I hope that you will keep on engaging with this conversation, that we will see many of you at COP negotiations, engaging with negotiators and engaged in the climate conversation and advocating for climate action that can help deliver a healthy and a prosperous future for all. And with that, I thank you very much. I know that we have a few questions, so I'm going to hand over to Audrey to chair this discussion.
Thank you so much, Marina, for a wonderful lecture, and especially for doing it from the floor of COP29. It's very much appreciated. We do have some interesting questions from people listening in, and perhaps we should start with a few questions on impacts and then talk about mitigation and adaptation. We have some questions about what you think we could do better in terms of understanding the impacts of climate change on people's mental health. So you've talked about a range of different health impacts. What do you think we're doing well in terms of tracking impacts on mental health, and what are we doing less well?
Yeah, look, the mental health impacts of climate change, some evidence shows us that they're as complex and as pervasive as some of the physical impacts that we're seeing. But unfortunately, we're not being able to capture that very well. And the main reason why we're not being able to capture the mental health impacts is that there's not standardized data on mental ill health. It's very difficult to capture mental health impacts in a standardized manner. And what that means is that sometimes it goes unnoticed. We don't have it as a number. We don't have it in target setting. So there's a lot that we need to be doing despite not having the direct numbers, the direct quantification, but having enough evidence to know that there's mental health impacts of climate change. And one thing that I do want to note is that one of the areas where we see the least action of health systems in terms of early warning and early response systems is on mental and psychosocial health. So it's one of the areas that our health systems are least prepared to respond to, and that has such huge impacts. As I said, that finding from Australia really shocked me. A 1.2% increase in suicide and emergency mental health cases per degree of temperature increase is huge, particularly for young children. That is hugely important. So there's a lot more that we need to be doing to preparing our health systems to respond, even if we don't have the numbers and the evidence, because we know that the impacts are there.
No, absolutely. Thank you for that. You just mentioned children in your response and impacts on children. And we have a question about what the countdown finds in terms of impact on children's health, and whether you have any recommendation on adaptation-linked indicators that we should be tracking in relation to children's health in the future.
Yeah. Another very important question. Our indicators are generally not sensitive to children in particular, but what we are seeing is that some of the risk factors that affect children the most are the ones that are being exacerbated by climate change. So, for example, as I spoke about food insecurity and malnutrition can have permanent impacts on children's physical and mental development. We know that that is particularly urgent for children, that we act on that. We know that air pollution can have permanent impacts in their lung development, in their physical development, in their mental health as well. We've seen also that the spread of infectious diseases encompasses some of the pathogens that are affecting children the most. We've seen an increased risk of transmission of pathogens like Zika virus that affects children, and particularly unborn children. And we're seeing that apart from the current impacts of climate change, there's a huge problem that our future generations will be facing, because the climate change risks are growing across every dimension of the risks that we track. And throughout their lifetime, children born today will be affected by growing climate hazards that will define their health profile. So the extent to which we address climate change today or not is a critical intergenerational justice issue. Which future will they be facing? How will their health be affected throughout the life cycle is what we're negotiating here today.
Yes, and we're very much seeing that reflected in children and young people being such climate change activists. They know they have a stake.
Yeah.
Given your COP29, I don't know whether you're at liberty of answering this question, but how much of the conversations that you're hearing at the moment at the COP reflecting an understanding of the health co-benefits of climate change action?
Well, I've been engaging in a lot of health pavilion conversations, and there has been very prominent. I have a bit of a suspicion that we're in a bit of an echo chamber. The co-benefits are being understood within the negotiations where we have health formally included. So we've had negotiations with the presidency of COP. There's been a new coalition that's been signed between the presidencies of the COPs of the past 4 years to support continuation, and of Brazil as well, upcoming COP, so the continuation of climate action, and acknowledging that the health co-benefits are a huge sector that could provide encouraged action, that could unlock finance, that could provide benefits not only for health but also beyond. So in those conversations there is acknowledgement. However, in the main negotiations, I don't think we've managed to pass on that understanding, and particularly the understanding that those health co-benefits can lead to much healthier populations that are more productive, economically more productive, and that it could save the health systems, it could save our NHS from increased pressure, it could reduce our health budgets. So the full dimension of the potential co-benefits is not at the center of the equation, but it's definitely very relevant to some of the acute discussion points. And we have to do a lot more to engage properly with the negotiations beyond our health echo chamber.
Brilliant. We have some people posting messages in the chat that don't feel as positively as you do about co-benefits. So one of them is asking a slightly tongue-in-cheek question, which is about the costs in number of human lives of going net zero in the health system. So are we going to lose people by going net zero with our health systems? What do you think?
Well, that depends whether we put health and well-being as an end goal. And that is the key of the discussion. We could achieve net zero through means that are really harmful to health in our health systems and beyond. We could shut down everything today and we would have no emissions, and that would be a massacre. So the whole conversation has to revolve around how to maximize health benefits. We cannot do harm, because what's the point? If the whole balance of this is negative, then we're failing. That's why we need to have health outcomes as the main goal of our negotiations. It's not about only saving the planet, it's about improving people's health, improving people's well-being. And that's why we're advocating for health to be at the center of the conversation, to minimize unintended harms to health, and to maximize the opportunities of a thriving and a prosperous future. So the answer is yes, definitely not increasing health harm. That would be failure.
That makes perfect sense. And we have a question about communication, I think, and climate change communication. Is it useful to continue the climate change conversation in such a human-centered way, given we're predominantly the cause of climate change? Should we be framing it differently?
That's a very interesting question, which I think I'm gonna contradict. Because the problem that we've seen, and we have actually an indicator that measures this, is that it has not been a human-centered conversation at all. The climate conversation has been mostly about, like, the symbol has been the polar bear for decades. And only now people are starting to understand that climate change is not happening in the North Pole in the year 2100, but it's happening to their homes, to their families, to their children. And that is a huge motivation for action. So I think I will kind of contradict that and say, I don't think we have humanized it nearly enough. What we see in the conversations here is that people really struggle to make the link with health. And it's bizarre because we're so used to it. We feel it so much. But you go to the negotiations and they're so used to negotiating about infrastructure, agricultural productivities, economies, glacier loss, physical parameters, that they kind of don't understand when you talk to them about health, because they haven't made that link the center of their conversation. But we are seeing a lot more engagement when we talk about health. We are seeing that it does help unlock some of those conversations, because that's the common good. And we hope that by increasing the focus on what people actually care about, that is their health and their well-being, we can help engage people and not label this as environmentalists that want to save polar bears and kill us all, but actually about protecting health, protecting lives. And that's what it should be all about.
Thank you for that. We have a number of questions which are thinking about countries that have benefited from globalization through increased trades and are still continuing to grow their emissions. And one question in particular, which is asking whether improving health and environmental outcomes through climate action will be in detriment to economies and jobs, particularly in those countries whose GDPs have grown so much thanks to globalization.
Yeah.
Is this all going to be terribly bad for the economies of those countries?
Look, unfortunately, what we've found is that the cost of inaction is in the order of tens of trillions to the economy per year. So we're in a situation in which we cannot, it's not available anymore to continue down the current path, that if we don't act on climate change, the losses will very vastly exceed any sort of loss of cost of action. So that is the one thing. It's not that we're just keeping the current trajectory or acting on climate change. Is, are we gonna go through huge economic losses associated with the health and the non-health impacts of climate change? Or are we gonna tackle climate change and minimize those losses and continue enabling prosperous futures? So that is the first thing. The second thing is, yes, by decarbonizing, by phasing out fossil fuels, obviously the labor market needs to change. It definitely needs to change. And that's why we're monitoring the stranded assets and the employment, because we need to understand we cannot keep on expanding a sector of the economy that is threatening people's health, threatening people's survival, and that goes against all of our legally binding commitments. Because we keep, it's like investing in Blockbuster. You wouldn't do that sensibly. It's not legal anymore, because if we want to reduce our greenhouse gas emissions, we have to decarbonize. So this is not about, like, the economic case is there, and there's a report that came out, was published yesterday by the World Bank, which is very worth reading, that shows the huge cost of inaction that we could be avoiding by tackling climate change.
Yeah, it's extremely important to understand that. I wonder, you told us a little bit about how, oh, there it is.
Yeah.
Straight from the floor.
One from the hydrological cycle as well. Yeah.
You've told us a little bit about what you're hearing at the moment at COP29. I wonder how much of the loss and damage conversation at the moment is also about health, or is it about other types of impacts? How much does health feature?
It does feature. It's not the most prominent aspect. In general, the loss and damage conversation has a lot to do with kind of economic losses and assets. But health it's being labeled as what we call the non-economic loss and damage, although it does have economic implications, and it is gaining a lot more prominence. And it's particularly the most vulnerable countries that are bringing that to the center of the conversation. Some small island developing states are one of them. They've been facing the health impacts of climate change for decades, so they're really starting to elevate that narrative quite a lot. In Africa, the same. They're seeing those acute impacts of climate change in terms of their burden of infectious diseases, their access to nutritious food. So it's those most vulnerable countries that are elevating the discussion. But I still don't think we've managed to capture enough the whole dimension of the losses and the damages that we will inevitably face due to our inaction or insufficient action over the past decades, and a lot more needs to be done to elevate the health aspects more prominently.
Yeah, we're hoping to hear some more announcements about loss and damage shortly. We have a sort of, it's not a philosophical question, but clearly a very academic question. Somebody's wondering what you've learned about global academic collaborations of the scope, the size of the countdown through this initiative, about what works well to maintain those collaborations and to keep them going over the long run.
What we've noticed, and we've been very fortunate, the 300 researchers that contribute to this initiative are wonderful. They're very dedicated. They contribute because they believe that this is the best thing that they can be doing with their wisdom, with their expertise. And I think that is the key to it. It's about making sure that our science is worth it, that the enormous amount of work and effort that we put in our research is changing people's lives, or it has the potential to change people's lives. And because we're having such active conversations that are so acutely dependent on data, we are seeing so many opportunities for translating that science into action, and that's a huge motivator. And we're very lucky, and I think very unique in this space, that we have so much engagement, so much generosity from researchers around the world that want to contribute. It's a wonderful experience. I recommend it to everyone, because it's really, really encouraging to see how much energy there is when you put your heart to it, when you have a common cause, and how much we can achieve jointly as a result of that.
Thanks, Marina, for this rallying and encouraging call as well, and Thank you so much for such a wonderful lecture and for all your really inspiring work with the Countdown team. Wish you all the very best at COP29. I think many people in the chat have said that. And we hope that it goes well. I'm just checking to see if there are any last minute questions in Slido. In case not, then I thank you all very much for attending today's lunch hour lecture. The next lunch hour lecture, which is entitled From Gene Deserts to Druggable Pathways in Inflammatory Bowel Disease, will take place on November the 26th. So please join us then. Thank you again, Marina.
Thank you, everyone. Thank you for joining. Thank you, Audrey, so much.